Welcome to the 2025 Open Enrollment Meeting. My name is Rebecca Hawes. I'm with Gallagher Benefit Services, and I'll be discussing your options for the 2025 plan year. As a reminder, open enrollment is the one time per year that you can make a change to your benefit elections without having a qualifying life event. When I state make a change, this is the time of year that you can make a change from one medical plan to another. Perhaps last year you didn't enroll in the vision plan, and this year you want to enroll in vision. These are the types of changes that you can make during open enrollment. Open enrollment starts today, October 14th, and will go through October 25th, 2024. All benefits elected during open enrollment will become effective on January 1st, 2025, and will remain in effect until December 31st, 2025, unless you experience a qualifying event. What happens if you have a change during the year? Please note that the qualifying life events listed on the screen allow you to make a change to your benefits. However, you must let your HR team know within 30 days of the event date that you would like to make a change to your benefits. For example, if I have a newborn born child on March 1st, I am required to let my HR team know within 30 days of March 1st that I would like to add my new baby onto the medical plan. If my 30-day window expires before I let my HR team know about this new addition, I will have to wait until the following open enrollment before I can make any changes to my benefit plans. What is new for 2025? The great news is that your medical plans are staying exactly the same, including your deductibles. Fifth generation is going to continue to pay 100% of the employee-only $6,000 HDHP medical plan. Fifth generation continues to contribute to each health savings account that an employee is enrolled in if they have the $6,000 HDHP medical plan or the $4,000 HDHP medical plan. Other important notes: Reliance Standard will be the new life, disability, accident, and critical illness carrier. Voluntary life includes a one-time special enrollment this year, allowing each employee to select up to $150,000 of voluntary life coverage. ACI Specialty Benefits will be the new EAP vendor. And also new this year is the rollout of the Dependent Care Flexible Spending Account. This is available to employees with dependents under the age of 13. Active open enrollment. You are required to re-enroll in all of your benefits for the 2025 plan year. Medical plans, terms, and acronyms. We wanted to discuss a few terms that we talk about frequently with our health insurance. Copay. Copay is that set dollar amount that you pay for a covered health service, usually when you receive the service. Examples would be an office visit copay or prescription drug copay. Deductible. This is the amount that you pay out of pocket for healthcare services before the medical plan begins to pay a portion. Coinsurance. This is your share of the cost of covered healthcare services after you reach your deductible. You pay the percentage noted on your plan, and the medical plan pays the rest. Out-of-pocket maximum. This is the amount you have to pay before your plan pays 100% of your covered cost. In-network. Facilities and providers that are considered in-network have a contract with the health insurance carrier. In-network providers typically provide services at a lower negotiated rate. HDHP refers to a high deductible health plan. PPO refers to preferred provider organization. An HSA is a health savings account. BCBS TX is Blue Cross and Blue Shield of Texas. As a reminder, your medical plans are not changing this year. Deductibles are staying exactly the same. With both the high deductible health plan and the preferred provider organization, all three medical plans are utilizing the same national Blue Cross and Blue Shield network we refer to as Blue Choice PPO. All plans cover your preventative care at 100%. All plans have coverage for virtual visits. The PPO plan specifically offers copays for office visits and prescription drugs, and the PPO plan will have the lowest deductible option. The high deductible health plans, all services will go towards the deductible first before the plan starts to pick up any portion. With the high deductible health plan, you are allowed to open up a health savings account that you can put tax-free money in, plus get free money from your employer. The high deductible health plan has the lowest premium option deducted from your paycheck. Again, you have three medical plan options to select from. The $6,000 high deductible health plan, the $4,000 high deductible health plan, and the $2,500 PPO plan. We're going to discuss the $6,000 high deductible health plan first. If I'm an employee only on this plan, I have a $6,000 individual deductible, but I am receiving $2,820 from fifth generation if I select employee only coverage. So in reality, my deductible is really only $3,180 because I can use the money that I've received from my employer in my HSA towards my deductible. Once I pay $6,000 out of my pocket on this plan, Blue Cross and Blue Shield picks up at 100% for the remainder of the calendar year. You can also see the different amounts that my employer is going to contribute to my HSA, depending if I have coverage for spouse, children, or family. The $4,000 high deductible health plan listed in blue also works in the same manner. Again, I have a $4,000 individual deductible. I am receiving over $2,000 from my employer in my HSA. So if I take that into account, my deductible is really only $1,960 for an employee only. Once I have paid that $4,000 out of my pocket, the plan picks up at 100% for the remainder of the calendar year. The $2,500 PPO plan has a $2,500 individual deductible, but it is not eligible for any health savings account from my employer or employee. My out-of-pocket maximum is $6,000 worst case scenario. Once I have met my $2,500 deductible, Blue Cross and Blue Shield picks up at 80%. I'm responsible for 20% until I reach that $6,000 out-of-pocket maximum. It is important to note that there are co-pays under this plan where the deductible does not apply. So for the $2,500 PPO plan, if I go to the primary care physician for an office visit, I'm only paying a $25 copay. Or if I go see a specialist, I'm paying a $50 copay. However, on the two previous plans we discussed, the high deductible health plan, I'm paying 100% of those charges from that primary care physician until I reach my deductible. One important note is preventative care. You'll see that on all three plans, it states 100%. This means that it is covered at 100%. There's no charges towards your deductible copays, or coinsurance. It is truly 100%. Things that come in classified as preventative care include annual adult physicals, well woman checkup, well baby checkups, flu shots, colonoscopy, mammograms. These are all examples that if those claims are coded as preventative care, they will be covered at 100%. Please note on both the high deductible health plans, my prescription drugs are covered at 100% after deductible, so I'm paying 100% of those negotiated pharmacy costs until I reach my deductible. On the $2,500 PPO plan, the deductible does not apply to your prescription drugs, and you'll be paying a set copay amount. Next is listed your medical rates. We've included the medical rates for the three plan options, and we've also included the HSA contribution that you'd be receiving from your employer depending on what tier you select. Where to go for care. If it is a life or limb threatening event, please go to the nearest emergency room. However, we often find that emergency rooms are being abused for care that could be seen at urgent care, virtual visits, or after hours. So in this slide, we're trying to illustrate the different costs that would be coming out of out of your pocket depending where you seek care. MD Live is the virtual visits. It's going to be the least expensive. Office visits is going to be the second least expensive. Encourage you, if you have a primary care physician, to check and see what type of after-hour clinics they might have. Here locally, where I go see my primary care physician, they also have availability on Monday through Friday from 5 to 8 p.m. and also on the weekends from 8 to 5. Urgent care clinics are a great option as well. The most expensive is going to be these hospital-based emergency rooms, and then these freestanding emergency care clinics. All across the United States, we see freestanding emergency care clinics popping up. They look like an urgent care because they are not tied with a hospital, but they are a 24/7 emergency room. These freestanding emergency care clinics are going to be the most expensive place for you to go to receive care. Virtual visits. Virtual visits, also called telemedicine, is a great way to receive care for some common conditions, such as pink eye, sinus infection, cold or flu. With a virtual visit, you do not need an appointment. Typically, it takes about 10 to 15 minutes, and you are able to see a doctor, and they can write a prescription for you if needed. And then you'll just go to your local pharmacy to pick up that prescription. A great advantage with the virtual visit is that you can do it from any place. Perhaps you're working, maybe you're on vacation, maybe you're at home sick and you just don't want to drive into the doctor's office. A virtual visit is a great alternative for you. Under the PPO plan, it's a $25 copay. Under the high deductible health plan, it is a $48 charge that is applied towards your deductible. We've included the website for MD Live as well as the 800 number. Encourage you before you request your first visit to go in and register online and complete your medical history disclosure. Prescription drugs. If I'm on those high deductible health plan, my prescription drugs are going to apply towards my deductible first, so I'm going to have to pay out of pocket. I could be receiving the exact same medication, but take it to two different pharmacies and my cost is going to be different. I encourage you to go through Prime Therapeutics, who Blue Cross and Blue Shield owns and uses for the prescription drug portion of your medical plan, to compare pharmacy pricing. I personally utilize this tool. I'm able to go and see if my local Walgreens is more or less expensive than my local Costco. Again, I encourage you to do this, especially if you're on a high cost medication or a medication that you're taking on a routine basis. Ask your doctor for samples while you're at his office if he's giving you a new prescription. See if he has any samples to provide you. This allows you some extra time to go shop around and see which pharmacy has the best price for that medication. And then again, don't forget about the mail order options as well as the specialty medication. Blue Access for members, referred to as BAM. With Blue Access for members, I encourage you to register and log in. You're able to find personal information about your medical plan. There's a great provider finder tool. You can request and print your ID card. You can check the status of your claims. Did Blue Cross and Blue Shield receive that claim that you went and saw that doctor for yet? How much do I owe towards that doctor visit? All of this type of information you can find through your Blue Access for members. You have a great 24-hour nurse line. This is covered with your medical plan. There's no additional cost to you when utilizing. You have access to registered nurses 24 hours a day, 7 days a week. This is great if you have a question that pops up, and perhaps your doctor's office is closed, it's on the weekend or late at night. You can access this nurse line. Maybe it's about a medication you received. Maybe you're in a situation where you don't know if you need to take your child in to see the doctor immediately that night to go to the emergency room, or can it wait till the next morning when your doctor's office opens up? By calling the nurse line, they're going to help triage the situation, ask you some questions, and then give you advice on how to handle the situation. Blue Cross and Blue Shield has several additional programs that are included with your medical plan at no additional cost to you. If you are a diabetic, there's a great diabetes management program. If you're having some back issues, Hinge Health is fabulous. There's a digital weight loss program, Wonder Health, that has proven to be very successful for people when trying to lose weight. Well On Target's going to provide you with wellness resources, including a discount to a fitness gym membership. And then there's a great women's health program. Do you have a family? Are you starting to think about having children? This women's health program can help you with a lot of different aspects. Alex, we are utilizing Alex again. It is a great resource for you when trying to select which medical plan or any of the plans might be beneficial to you. With Alex, it's personalized because he's going to ask you some questions about your personal health history. He wants to know how many dependents are you going to cover. He wants to know if you're on any medications. How often do you go to the doctor? And then is anything upcoming for the 2025 plan year? Even if you've used Alex in the past, encourage you to do it again each year because our situations might have changed. This slide is just a claims example of an infrequent user. We often get the question about which plan is best for me. Alex is a great tool to help you with that. This is a tool that just helps you start thinking about which plan might be your best option. You'll see that we have your three medical plans listed across the top, the $6,000 high deductible health plan, the $4,000 high deductible health plan, and the $2,500 PPO plan. Again, this is an infrequent user. This employee had an office visit, has a monthly maintenance prescription, an urgent care visit, and a specialist visit. About midway down, you'll see total medical cost incurred. This is how much this employee would have to pay out of his or her pocket in the form of deductibles, copays, or coinsurance. The $6,000 and the $4,000 HDHP plans are both $865 out of pocket. The $2,500 PPO plan is $330 copay. Annual premium cost. How much am I having to pay for this medical plan? What is being deducted from my paycheck on an annualized basis? For the $6,000 high deductible health plan, if I'm employee only, it's free, there's no cost. For the $4,000 high deductible health plan, $720. For the $2,500 PPO plan, it's $1,800. The employer HSA contribution. Remember, I'm getting free money from my employer if I sign up for either one of the high deductible health plans. So on the $6,000 high deductible health plan, that $865, I'm able to use the dollars that my employer put into my HSA and still have money left over at the end of the year. On the $4,000 high deductible health plan, again, I'm able to pay that $865 out of the over $2,000 that my employer's given me in my HSA. The only cost I have on this plan is what's come out of my paycheck for the health insurance premium. On the $2,500 PPO plan, I've had to pay the $330 out of my pocket in copays, plus $1,800 out of my paycheck for a total of $2,130. This is a worst case scenario. So again, we're employee only, but this is what we would call a frequent user. They either have a chronic condition that they are having to be seen for and have a lot of treatment for, or perhaps they've had a situation they've been hospitalized for several days, weeks, or had a surgery. Regardless, this employee has reached their out of pocket maximum. Doesn't matter which plan they enrolled in, they would have reached that out of pocket max. So $6,000 on that $6,000 high deductible health plan, 4,000 on the 4,000 HDHP, and then $6,000 on that $2,500 PPO plan. We look at that annual premium cost again that we just referred to in the previous slide. We can't forget about having that money from our employer HSA to help offset that out-of-pocket maximum. And then we get to the total annual cost, how much it would have cost us in deductibles, copays, and coinsurance, plus out of our paycheck. Health savings account, also referred to as an HSA. If you participate in the $6,000 high deductible medical plan or the $4,000 high deductible medical plan, you will be eligible to enroll in the health savings account. What is a health savings account? It is just that. It's your personal bank account that you can use for eligible medical, dental, and vision expenses, not only for yourself, but for any eligible tax dependents. Your unused balances accumulate over time. There is no use it or lose it penalty. Funds are available after your contributions are deposited into your account. The health savings account is one of the only accounts that offers you a triple tax advantage. The money you put into your HSA is tax-free. While your HSA account is there growing, all of that grows tax-free with the interest earned. And then when you withdraw the money, as long as you're using it for eligible expenses, it remains tax-free. Who qualifies for the HSA? Again, you have to be enrolled in that high deductible health plan. Not covered under a non-qualified health plan, and this includes spousal coverage and Medicare. Not claimed as a dependent on someone else's tax return, and not participating in a traditional flexible spending account, and this includes your spouse. If you're legally married and your spouse has a traditional flexible spending account that he or she is putting tax-free money into, you would be ineligible to participate in the health savings account. How much can I contribute to my health savings account? This is an IRS regulated account, so each year they have a calendar year maximum. We've listed the calendar year maximum. Please note that this calendar year maximum includes dollars from yourself as an employee, plus your money that you receive from the employer. So we've also listed the HSA contribution you're receiving from Tito's, plus how much can you contribute after we take that into account. It's important to note that if I am 55 or older, I can make an additional $1,000 contribution on top of the already listed dollar amounts that you're seeing. Dental. Your dental plans are staying exactly the same. There's been no changes. You have great coverage with the base and buy-up plan. The difference between the two plans is that your buy-up plan is offering orthodontia services not only to your children, but also to you and your spouse as adults. If you are going to need braces for yourself or any dependent children, then you're going to want to look at the buy-up plan. There has been a slight increase to our dental rates this year. We encourage you to find an in-network dentist when utilizing the plan. If you go out of network, you will be balance billed. You will be balance billed even for typically a cleaning that is covered in network at 100%. If you're going out of network, that dentist does not have an agreement with Blue Cross and Blue Shield, and they can balance bill you for additional dollars. Vision, there's been no changes to your vision. Often what happens is employees aren't utilizing the vision plan. So I encourage you, if you haven't utilized your vision benefits this year, go out and get those new glasses, go get that eye exam done. Maybe it's contact lenses you need instead. Again, this is an opportunity. You are paying the premium for this, so I encourage you to take advantage of it. Again, no changes. The benefits are staying exactly the same. Your rates for the vision plan are also staying exactly the same as they are for the current plan year. Life AD&D, voluntary life AD&D, and disability benefits. You work for a great company that provides you a $75,000 basic life and AD&D, standing for accidental death and dismemberment insurance, at no cost to you. You have the option to elect additional life insurance. You can elect up to $150,000 for yourself as an employee with no medical questions. This is a one-time special enrollment because we are moving to Reliant Standard, that you have the opportunity to purchase this life insurance with no medical questions asked. As a spouse, you can purchase up to 50% of the employee's elected amount. Up to $50,000 is considered guarantee issue for your spouse. And then your children, you can enroll them if they're under the age of 26 for up to $10,000 with no medical questions. Disability insurance. Fifth generation provides you both short-term disability and long-term disability at no cost to you. This is a terrific benefit. We typically don't find employers offering both the short term and the long term. So you work for a great employer providing you such terrific benefits. For short term disability, you would have to be out of work for 14 days due to an accident or illness. After the 14-day elimination period has been satisfied, you will receive 60% of your weekly earnings, up to $1,500 per week. Potentially, you can receive this up to 11 weeks or until you're no longer determined disabled. If you are still considered disabled after your 11 weeks, that claim rolls into what we call long-term disability. With long-term disability, your benefit moves to a monthly benefit. You'd receive 60% of your monthly earnings, up to $6,000 per month. Your elimination period of 90 days is covered under your short-term disability policy. And you can potentially receive this up to Social Security normal retirement age or until you're no longer deemed disabled. Financial wellness benefit. You have a great financial wellness benefit through your money line. This benefit is 100% free to you. So your employer has provided you with access to financial guidance, to a financial counselor, 100% for free. We all have different stages of our lives. Maybe we're just getting started out and we're looking to buy a new home. Maybe we're starting our family. Maybe we have kids that are about to go to college. Maybe we're looking to get out of debt. Maybe we have some student loans we need help with. Maybe we're looking towards retirement and we're looking to make sure we're properly prepared. These are all examples of situations that your money line can help you with. Encourage you to take advantage of your money line. We've provided you with the website on the slide. It is a great benefit, again, offered at no cost to you. The lifestyle spending account and the dependent care account, those are going to be administered through WEX again. For the 2025 plan year, You will receive $1,000 annually again. You're going to get 500 funded on January 30th and 500 funded on July 30th. You must call WEX to enroll in this account. If you are already enrolled in the lifestyle spending account for the 2024 plan year, then there's no action needed on your part. Your dates of services for the new plan year must be January 1st, 2025 through November 30th, 2025. We've listed a small portion of some of the eligible expenses, but things like amusement and water park tickets, health club and fitness gym membership, exercise equipment, expenses towards a home purchase. These are just some of the examples that would be considered an eligible expense. This is a use it or lose it policy. If you do not use your funds by November 30th and you do not submit your receipts by November 30th, you will not have access to those dollars and you will lose them for the 2025 plan year. That includes the current plan year of 2024. So that deadline of November 30th, 2024 is quickly approaching. I encourage you to utilize this plan. New this year is going to be the dependent care account. This is an opportunity for you to put tax-free money aside to use for eligible expenses that include daycare, after-school care, preschool, summer care. You can contribute up to $5,000. This is only for employees that are receiving dependent care for children under the age of 13. The care must be provided during working hours while you and your spouse are working, or enabling your spouse to look for work or to attend school on a full-time basis. Dates of services must be from January 1st, 2025 through December 31st, 2025. This is a use it or lose it account. Please be careful on the dollar amount that you're putting into this account and be 100% for sure you will have the dependent care expenses to reimburse yourself. Worksite benefits, again, these are moving to Reliance Standard. You have the option to purchase a voluntary accident plan for yourself and your dependents. An accident plan pays you money when you have an accident and you have to seek medical care. I have this plan for my children, and my 18-year-old daughter had a concussion from playing basketball. I was able to receive $200 for her concussion. I received another $300 for the emergency room treatment. She also had an x-ray done, so that was another $75. Again, this is just an example. These benefits, though, can add on top of each other depending on what type of accident you have and what services are rendered. The voluntary critical illness plan, this allows for you to select a benefit amount. And if you have one of these covered illnesses while being covered under this plan, they give you a cash benefit back. For example, if I select $20,000 during open enrollment and come February 1st, I have a heart attack, Reliance Standard would send me $20,000 in a check format, and I can use that money at my own discretion. For me personally, I'm probably going to be out of work if I've had a heart attack, so I'm going to use that to offset my expenses while I'm out of work because I'm still going to be having to buy groceries and pay the home mortgage, etc. You can also purchase this for your spouse in increments of $1,000, not to exceed 100% of your elected amount. And then your children would receive a 50% benefit if they incurred one of these covered illnesses and were covered as well. There is no additional cost to cover your children on this policy. Both the accident and the critical illness have a wellness benefit. That is a $50 wellness benefit that they would pay you just for going in and getting your annual adult physical or your well woman exam. Here are some of the tests that would be included that would you would be able to reimburse yourself that $50 wellness benefit. So if I'm going in and had a colonoscopy, I would have to submit that claim to Reliance Standard, and they would send me a check back for $50 that I could use at my own discretion. Pet insurance. You have the opportunity to purchase pet insurance at a preferred price through your employer. You can select either a 50 or 70% reimbursement on eligible vet bills. You can use any vet. There's no network, no pre-approvals. If you're interested, we've included the website as well as the 800 number to get a quote. Employee assistance program. Again, you have an employee assistance program free of charge to you. You have access to this online or through the 800 number that we've listed. You have up to 3 face-to-face visits free of charge per issue. An employee assistance program can help us with so many different things. Maybe we've lost a loved one. Maybe we're struggling with a tough health diagnosis. Maybe we have a stressful relationship at home. Um, Maybe our parents are getting older and we need help figuring out elder care and how to help them while we're working full time. Maybe it's a legal or financial issue. These are all examples of what the EAP can help us with. I encourage you to take advantage of the EAP if it can help you or your dependents. Enrollment. As a reminder, this is an active enrollment. You will be required to re-enroll in your benefits for the 2025 plan year. If you do not actively re-enroll in your benefits will be terminated effective December 31st, 2024. We're going to go out and use that Workforce Now ADP website again to re-enroll. In your benefit guide, there is steps to take during your enrollment process. We encourage you to review your benefits guide. We encourage you to use Alex to make sure that you have the best plan for you and your specific situation. If you still have questions, we have the Benefit Advocate Center. And of course, then we're going to log into that Workforce Now ADP.com website, and we're going to select our benefits. If you're adding dependents, please be sure that you have your dependent documents ready. For example, if I'm adding a child that I did not have last year on my plan, I need to make sure that I have my birth certificate to confirm that that is my eligible dependent. Update your contact information in ADP Workforce Now so we can make sure those ID cards are getting sent out to the correct address. Here is a sample screenshot within the ADP portal. We always just want to make sure that we're viewing all plans and viewing all benefits when we're selecting and going back to the benefit selection page. Thank you so much for listening to the open enrollment meeting. If you have any questions, we've provided you with some websites. Provided you with some email addresses, the Benefit Advocate Center, myself, Rebecca Hawes, as well as Rob David in our office, who can help answer any questions that you might have regarding open enrollment.